Welcome back. Global efforts to end smoking have stalled and require a drastic overhaul to prevent 1 billion people from dying in this century. Now, this is according to a new report by 5 leading experts who are members of the International Commission to reignite the fight against smoking. Now, there are over 1 billion smokers worldwide and nearly 8 million people die of tobacco-related causes every year. For more on this, let's bring in health expert Dr. Kgosi Letlape, who joins us now for this conversation. Dr. Letlape, thank you for your time and happy Heritage Day to you. Quite concerning that these global efforts have been halted seemingly. Why do you think this is so?
Good morning to you and the listeners, and happy Heritage Day to you and the rest of South Africa. I think that things have stalled largely because what we're using to combat smoking is what is called a Framework Convention for Tobacco Control, which basically was released by the WHO in 2003. And it has over 100 signatories in terms of the nations. And the challenge is that it has done tremendously well to reduce the prevalence of smoking in some countries from around 50% to below 20%, around 17, 18%. In South Africa, our prevalence is around 16%, where we have 7 million smokers. But we've sort of reached the limits of what we can do, and the reduction of smoking has slowed down across the world. They have what they call the Empower formula, which includes cessation. In nations like ours, cessation clinics are not readily available to the public. Fortunately, in 2003, there's something that was reignited called the e-cigarette. A pharmacist in Hong Kong, Mr. Hon Lee, this basically reinvented the modern e-cigarette. We now have technologies in this century that can make a difference. If you remember that in 2000, there was no iPhone. In 2000, there was no Google search. But tremendous strides have been made. And what we are saying is that we can now reignite the fight against smoking by using the novel technologies. Right. What we know, and what all of us know, is that people die from smoking because of combustion of cigarettes. So there are now a myriad of non-combustible alternatives, including smokeless tobacco.
Doc, if I may, I just want to jump in and talk about exactly that, the deaths due to tobacco, related causes. 8 million, I understand, is the number we're sitting at each and every year in terms of these deaths. Now, with the COVID-19 pandemic, is that number still the same? Has it, increased? Where do we stand right now in the context of the pandemic?
We don't think there would be a major change in the number. There's just a concern that because of the isolation of COVID in terms of restrictions, you may have had people that have relapsed into smoking to deal with the challenges that they have. But we presume it would probably still stay around the same. Now, in terms of our current efforts, we project that by 2050, there would be about 6.5 million deaths. If we embrace technology, those deaths could be reduced to 3.5. So by embracing technology, we can reduce the deaths by more than 50% from the deaths that we see today. And you are relating it to COVID. If you look at COVID, in a nearly 2-year period, we've lost nearly 4 million people globally to COVID. Annually, we lose 8 million to tobacco-related diseases. It is time we reignite that. There are many factors that make the issue slow. Smokers are considered sinners. They are taxed. And one of the challenges that we need to look at is to ensure that the alternatives to combustible cigarettes are made affordable. Because one of the major challenges is that in any society, you find that the people that earn less, lower LSMs, are the ones that smoke more. We also see a much, much higher incidence of smoking in people that have mental illness. So we need to ensure, and homeless people, indigenous people. So smoking rates are high in marginalized communities. So we need to ensure that they are not marginalized by lack of access to these risk-reduced products. So we all have to work together, including governments, to ensure that the products are not only available, they are accessible. And we should follow the example of the National Health System in England, which currently provides e-cigarettes to people that cannot quit with other methods.
Well, I appreciate you talking to us, Dr. Kgosi Letlape. Thank you so much for placing this issue, of course, on the spotlight once again.